Kinshasa, capital of the Democratic Republic of Congo. 10 million inhabitants, or perhaps 12. Nobody knows. The last census was in 1984. Since then, how many babies have been born? In the suburbs of the city, a young woman about to give birth comes to a private clinic. She is alone. This is often the case in Congo. To prevent evil spirits interfering, childbirth is kept secret. Even close family don't know that the mother is about to give birth. Hygiene conditions are minimal. Comfort, Spartan. At 10 p.m, a power outage plunges the clinic into darkness. The young woman has to take care of herself. Contractions have been causing her pain for 4 hours. After a labour lasting several hours, the young woman finally delivers the baby. This is her 7th child. She is 23 years old. In Congo, 1 mother in 20 dies in childbirth. The causes are many and varied. The mothers are unprepared or present too late, and the medical staff do not have the means to respond to complications. Some NGOs are working hard to improve maternity care and promote better health for all the Congolese people. A local NGO is particularly active in this area. It's the Kangu Center for Health Promotion. To get to Kangu, it's a 12-hour drive along the road through the lower Congo. The majestic Congo River can be crossed at Matadi. Then it's through the region of Mayumbe, which borders Angola. 550 kilometers from Kinshasa is the village of Sioni, home to the Kangu Center for Health Promotion. Dr. Jacques Courtejoie lives here. For 55 years, he has been a tireless promoter of preventive medicine, and not only in the field of maternity. He is also concerned with malnutrition, AIDS and malaria.
Listen, there's an opportunity here. You know our book, Tropical African Malaria? We're completely out of stock. All the schools are asking for it. We can't supply and the school year is starting. We really need you to help us out right now.
In 1962, assisted by a small local team, Jacques Courtejoie founded the Kangu Center for Health Promotion, managed today by 2 Congolese, Clément Muzungu and Roger Mabiala. Jacques Courtejoie is from Belgium.
I was born in Stavelo in the Belgian Ardennes, and I was there during the Battle of the Bulge. I was 14 or 15 years old, and I met lots of US soldiers, including some African Americans. They were the first black people I'd seen. For me, a black person was a guy who weighed 190 pounds and gave me chocolate, chewing gum and cigarettes.
At 20, Jacques Courtejoie decided to study medicine to be able to care for people in his Belgian village. During his military service in 1958, he was sent to the Belgian colony of Congo, where he found his vocation. The colonial administration later sent him to Kangu in the lower Congo.
I looked after the people in Kangu, and I realized that here were many more sick people than in my village at home, and there was an important job to be done.
The oldest villagers remember the arrival of Dr. Courtejoie. One of them is Papa Landu, who worked with the Belgian doctor for 40 years before founding his own clinic. Landu remembers that the doctor's name, which literally means short joy, aroused suspicion in the population. Was this doctor really short on joy?
People were astonished and said, "This doctor who's coming, Courtejoie." In the Mayumbe language, we say, "Maknini Makofi." Everyone was wondering, is he a nice man? And of course, when he came to Kangu, he was just the nicest person.
For 30 years, Dr. Courtejoie was the chief doctor at the Kangu hospital. He remembers deciding to stay at the time of Congo's brutal accession to independence in 1960.
In the first months after independence, I was the only doctor in the area, and people got to know me very quickly. They became attached to me, and I could clearly feel that they loved me. There were lots of problems, lots of abuse, rape, killings of whites, and I had to get through that. And don't forget, I was a vestige of colonialism. I was a colonial doctor. People had to agree that although I was white, I could stay.
Dr. Courtejoie then chose to dedicate his life to caring for the people of the remote village.
I spent my day caring for the sick, but I realized that there were many diseases that could be cured or prevented by changing behavior. I had to explain that to young mothers. I showed this poster that I'd brought back from Europe, which was great because you could see the malaria parasite in the mosquito's organism, and that the mosquito transmitted the parasite in its sting. You could see the parasite moving around the human body, causing malaria. So I went to the antenatal clinic to explain the problem. One of the mothers there told all her friends a funny story that I couldn't understand, but I could see that they were laughing at me. The woman explained that it was me on the poster because it was a white man, and this was a European mosquito, and that's why I had fled Europe, because the mosquito was big, bad, and aggressive. Mosquitoes here in Congo are quite different. You just have to do that and the mosquito goes away. I realized that my very academic attitude was totally inadequate. I had to make contact with local people who really knew the local culture and could tailor the messages I wanted to pass on. I continued patient care throughout the day, but on nights and weekends we had frequent meetings with a group of teachers and nurses to see how we could adapt the health messages. We had to use drawings and posters to get through to people who often had little education.
Based on the principle that a picture is the perfect support to words, young people in Congo have developed and tested a series of picture boxes, each one illustrating the story of a disease. Several times a week, nurses and students of health education go to the most remote corners to spread the word in support of the pictures, which capture the imagination. In Mayumbe, the wisdom of the ancestors had already taught people that a shield is better than a bandage, and you have to protect the eye before it is put out.
The Centre for Health Promotion started in the doctor's own house, next to the hospital. He remembers all the activity in these buildings, now partially deserted.
This is where I came in early 1959. I was here for 30 years, all the time I spent in the hospital. The house came with the job. The centre was born here, and we built various annexes to set up the units. Hello, do you all live here?
Yes.
I lived in the house for a long, long time. It was my home.
I know.
You know, but you weren't even born then. It's here that we store the books and picture boxes, all the centre's documents. I'm pleased to see it's still standing.
In 1988, Dr. Courtejoie retired from Kangu Hospital. He had to leave the premises and the centre moved to new buildings. It still produces the handmade picture boxes that have made Kangu's reputation. This morning, Jean Simba is visiting a primary school. This Kangu Centre educator gives teachers a kit entitled Education for Life, a euphemistic term to describe sex education, much needed in an area where it's not uncommon for girls still in 4th grade to become pregnant.
It is important that the children know that if they become mothers too early, there are consequences.
Do you get what they are saying about education for life? You do not have the obligation to give yourself to men. You young people must not become mothers or fathers too soon. What does too soon mean? Before you're old enough.
Pictures are a fundamental vector for getting the message across. To attract a younger, more urban audience, the centre also produces videos. Roger Mabiala, the logistics manager of the centre, has trained as a film director. So far, he's made 4 movies about the most crucial issues: malaria and AIDS. Picture boxes and videos are intended to raise awareness among the general public. For health professionals, the centre has been publishing reference manuals for 40 years.
We have a manual here on maternity and health by Jacques Courtejoie, which we use in our maternity unit to refresh our memories about what we should do as nurse midwives in the maternity ward of the Kangu General Hospital.
Maternity and Health is Kangu's bestseller, with nearly 100,000 copies printed so far. Jacques Courtejoie co-authored it with the late Dr. Rotsart.
Dr. Rotsart and I spent a full year developing an obstetrics manual. I have it here. Everything a midwife in an isolated place needs to know to ensure a safe delivery. It seemed an excellent idea, and we used this manual to train midwives. First we had to write it, then test it and distribute it. We saw later what was happening in some centres. We saw a medical centre where, when the woman arrived, she was told off for being late, dirty, unwashed, and so on. So we contacted the World Health Organization, and the officials told us that it's a fairly common problem. Once they have their diploma, some people think they're entitled to look down on the poor village women.
Dr. Courtejoie then proposed trying to change the staff's behaviour by emphasis on welcoming and respecting the patient.
None of this was mentioned in our famous obstetrics manual. We had to revise it. We were technicians and we only addressed the technical aspects. The woman who comes to give birth must feel that there's a real love for her, that we are ready to help whatever the situation, whatever the difficulties in which she's put us, but could have been avoided if she'd arrived a few hours earlier. Piranha, this book, Malaria in Tropical Africa, is out of stock. All the corrections are here. Everything's done.
Jacques Courtejoie is an expert recognised by the World Health Organization for his profound knowledge in the field. Although he's retired now, the doctor continues to update books published by the centre. The books are produced at the St. Paul print shop in Kinshasa. The manuals are then returned to Kangu, where they are stored, sorted, packaged and distributed all over Congo. Roger Mabiala takes care of all logistical aspects at the centre. He oversees the production of the books, manages inventory, and organises the distribution of manuals. He knows the significant cost of health promotion. Books are expensive.
In fact, we operate through sponsorship that we get from time to time. I'll give a typical example. There is a Belgian man who was born here in Congo who wanted to sponsor the school in the village where he was born. With 1,500 euros, we were able to equip the school. There is also the sponsorship of a medical library for doctors in the bush. It costs 120 euros. There are some that are sold to NGOs, like Memisa or Sanru. They have projects on the ground. Sometimes they buy kits that allow us to make some money. This tool will help you in your training and your practice as the nurses and laboratory technicians.
Roger Mabiala is a trained nurse. He's worked in Kangu for 30 years. Jacques Courtejoie quickly saw the true potential of a man fully dedicated to the centre's cause.
For 10 years, I have been going with Jacques to Europe, Belgium, the Netherlands, Germany, Switzerland, to raise money to republish our books. Because it became very complicated after 1990, when Belgian development aid was gone, to find the money to do the books.
Roger Mabiala is the right hand of Dr. Courtejoie, a man whose values he admires.
The spirit spread among us and allowed us to build strong teams, based on the spirit of confidence. So for me, Jacques Courtejoie is a role model, someone unforgettable. He is a true icon for me.
The Centre for Health Promotion specifically targets rural areas. Small nursing schools like this are key to changing the behaviour of the medical teams.
Moins de sang dans l'organisme, évidemment, l'oxygène aussi, ça va poser problème. Donc, ça, c'est dans le cas d'anémie. D'anémie, la personne qui n'a pas du sang. Vous devez être capable de définir des mains de différentes sortes de transfusions.
My name is Josephine. My father is disabled and remains in the village. It's not easy for him to pay my fees. He asked me to train as a nurse so that I can help him later on when I have finished my studies.
Josephine is a deserving and hard-working student, so she received a few Kangu books from a sponsor. They are a very useful complement to her training. Sponsors, private donors and public agencies continue to support Kangu's work. They understand that the centre's way of working can bring about a change in behaviour across the country. At almost 85, Dr. Courtejoie has put everything in place for the centre to carry on without him. He is now only a scientific advisor. The NGO is managed by a 100% Congolese team, led by Clément Muzungu.
I mainly deal with all the political, administrative, and tax authorities. So when there are issues to deal with, I handle them on behalf of the center. It is not always easy, but it always turns out fine when you stay cool and remain courteous to the people who come to see us. And we always end up agreeing.
Behind this soft-spoken man hides a formidable negotiator. well capable of steering the ship even in troubled waters.
The environment in which we now live in the Congo is tough. There's the war in the east, many problems. People are hard on each other. Survival is difficult for everyone. There's a lack of money and resources, and what we offer here, compassion, respect for others, love, forgiveness, it's all seen as something rather unusual. The way we treat each other here is completely transferable to any environment. The fact that we respect the people around us, that we consider them as persons of value, whatever mischief they make, means there's a lasting mutual respect that's transmitted and spreads to any community.
Jacques Courtejoie has returned to the Kango hospital that he ran for so long. He meets the area head doctor, Dr. Basile.
In your time, you put up a few buildings here at the hospital, apart from what already existed?
Is there hope for the future? Well, I think yes, definitely. The young doctors, quality nurses, quality midwives that I see around me, all these young people can pass on the message, can promote these attitudes. And I see the change now in the way the midwives treat the poor women who come to have their babies.
Ok, do, ok, do. Très bien, do. Titka, ok. Kada po la loya ba? Très bien, do. Moanga. Do, hapus. Pus. Moanga, wow.
I spent the most beautiful moments of my life in this room for 30 years. I'm so happy, really happy to see the midwife applying what's been taught for years, for many years. She respects the mother. She talks nicely to her. Even though this girl is only 15 years old and she had an unplanned pregnancy, she isn't reproached. The biggest improvement is in people's behavior. The women are shown respect. What motivates my life and my work here is essentially the love I have for the Congolese people, especially the Congolese people around me and what they give me in return.
Through Dr. Courtejoie's efforts, many Congolese mothers give birth today in much better conditions. By his example, the Belgian doctor continues to show that health promotion also involves compassion, love, and forgiveness.